Item of business is statement by Jean Freeman on COVID vaccine. The Cabinet Secretary will take questions at the end of her statement, and so there should be no interventions or interruptions. And I call on Jean Freeman for up to 10 minutes, please, Cabinet Secretary.
Thank you very much, Presiding Officer, and I'm grateful for the opportunity to set out our current plans to deliver a programme of COVID-19 vaccination to everyone over the age of 18 in Scotland. As I will cover shortly, there remain some key areas of information we have still to receive or confirm, and I will continue to update members as these become available and our plan develops. Last week, we all had the good news from Pfizer. This week, more good news from Moderna, both announcing over 90% effectiveness in Phase 3 clinical trials. These are just 2 of 12 vaccines undergoing Phase 3 trials worldwide, including 3 involving clinical trials here in Scotland. Pfizer and Moderna will now share evidence from their trials with the regulatory and advisory bodies to allow clinical and scientific review, with advice then to each UK health department to determine on safety and effectiveness. And this is a critical point. I want to be very clear to members and to people across Scotland that the safety of the COVID-19 vaccine is paramount for us. The global scientific, research and pharmaceutical community has come together and worked as never before. We've seen unprecedented investment worldwide in research, development and manufacture, people across the world, including here in Scotland, volunteering to take part in clinical trials, and driven and dedicated research teams. That is why we're seeing these front-running vaccines delivered in months, rather than the many years that vaccine development can sometimes take. It is impressive, but it is not at the expense of safety. Each vaccine goes through a rigorous and independent 3-phase testing process long before it can be licensed as safe and effective for use. Regulators like the European Medicines Agency or the Medicine and Health Products Regulatory Authority in the UK review the trial results and decide whether to approve the vaccine or not. During a pandemic, this timeframe can be compressed, but it is never at the expense of safety. Vaccinating the adult population in Scotland, that's anyone aged over 18, is 4.4 million people. We have rightly worked across the 4 nations to secure the vaccines and to secure agreement on the population share of the doses purchased for each of the UK nations. From December, we expect to see the first delivery of vaccines to Scotland. We're planning on the basis both that the JCVI, that's the Joint Committee for Vaccines and Immunisation, and are able to review the clinical evidence and provide governments with a recommendation, and that the vaccine receives a licence. As I've said, we're hopeful that over the coming weeks into 2021, we will have more than one vaccine available to us so that we can, with minimum delay, vaccinate as many people as possible, as quickly as possible. But I need to be clear that there are a number of challenges and, at this point, unknowns to our delivery programme, which we hope will, in full, take from December to spring next year to complete. The first of those, clearly, is the start date. We're ready for December, but the first vaccine available has to be approved and supplies have to arrive. Thereafter, we need to see more vaccines become available and to understand the delivery schedules for each. The Pfizer vaccine has specific requirements in terms of transportation, storage and accessibility for use in certain settings. Other vaccines will have their own requirements. They may be similar to Pfizer, they may be different. It will be important to understand those differences to inform clinical advice about deployment. Our national plan has to be able to adapt to accommodate where there are different requirements. A vaccine must be used in a way that ensures those most in need of protection receive that protection first. So our planning will be informed by the independent scientific and clinical advice from that Joint Committee on Vaccinations and Immunisations. The JCVI has already offered interim advice on prioritisation, which we've used in our planning for the early but limited vaccine supply we expect. In the first wave of our plan from December through to February, we will vaccinate frontline health and social care staff, older residents in care home staff, all those aged over 80, aged 80 and over, unpaid carers and personal assistants, and those who will be delivering the vaccination programme. The current interim advice from JCVI is that we then work through those aged over 60 and those over 65 and those under 65 who are at an additional clinical risk, and then we move to the wider population. I want to be clear that this is a national vaccination programme which sets out clearly the parameters within which our NHS boards will lead local delivery. So nationally, we will set out the policy direction, we will set out the delivery framework accompanied by a guide and information for those at the front line. We will develop and deploy a national workforce model, provide national training, undertake procurement and logistics, provide national information and advice, tools to record data about vaccinations so that they are there on people's medical records, and from phase 2, a national booking service. NHS boards will then lead local delivery, identifying acceptable and accessible locations, both for mass vaccination and for local access, taking account of their population and geography. They will undertake recruitment and deployment of staff and the management of local vaccination clinics. Over the coming weeks and months, we will be sending out information to everyone across Scotland, explaining what the vaccine is, how we are prioritising who gets the vaccine, what to expect when you're vaccinated, and so on. For those in the first wave of the programme, you will be contacted during December and January, either by mail or for health and social care workers by your employer, and you will be told where you will receive your vaccine, how to make an appointment, and what you need to know. In truth, Presiding Officer, this is a major public service exercise. We need the expertise and resource that our local authorities, community planning partnerships and third sector can bring. And we need locations, fixed and mobile, so we can make this mass programme as accessible as possible wherever you live in Scotland and whatever your circumstances. We need a workforce that is diverse in its skills and availability. Our planning assumption is that for vaccinators and support staff, we will need over 2,000 by the end of January, so that vaccine availability and delivery schedules yet to be confirmed, we will be able to vaccinate around 1 million people by that time. We, of course, need registered clinicians to vaccinate and to supervise vaccinations, nurses and doctors, but also the wider clinical workforce, such as pharmacists, dentists and optometrists. We've now concluded an agreement with the BMA on terms and conditions for GP involvement in the programme, and are working through agreements with other independent NHS contractors. But we also need a workforce that understands the importance of logistics, of minute planning for delivery, of location setup and building, of COVID-safe locations, and of the importance of data collection and performance management. Scotland has an excellent track record on vaccinations, but this is to be one of the biggest civilian logistical challenges in our lifetime. So we have strengthened our NHS planning teams, engaging with local authorities, local resilience partnerships and the military. We know from the beginning of the pandemic, when the military assisted in the delivery of NHS Louisa Jordan and the deployment of testing sites, that they bring real value to support our efforts. With so many vaccines in phase 3 clinical trials, there is the potential for multiple vaccines being available over the next 12 months, and it is possible that these will have different characteristics that impact on how they're stored, handled and delivered. That requires real logistical expertise from one organisation that can cover the whole country. So I'm grateful that the military have responded once again and stand ready to bolster our planning, bringing with them a wealth of logistical and operational expertise. Presiding Officer, it is important to be clear about what we don't know yet. We don't know which vaccines will be approved for use and when doses of those vaccines will reach us. We do not yet have information about all the vaccine characteristics. For instance, we don't yet know whether the Pfizer vaccine will be approved for transportation beyond the ultra-cold temperature currently used in order to allow us to vaccinate in multiple smaller locations like GP practices and care homes. Although we have some welcome news on the efficacy of the vaccine from the trials, we don't know if this vaccine, the Pfizer vaccine, will stop you getting the virus, stop you passing the virus on, or prevent it from causing serious harm. And it may take many months before we fully understand the level of protection on transmission and the impact on reducing the severity of the illness caused by the virus. We know that the first vaccines will require 2 doses, 3 to 4 weeks apart. It's possible that further booster doses and even an annual programme might be required, given we do not know how long any protection will last. For now, the important thing is that when we start to deliver these first vaccines, it will be on the basis that they offer some form of protection, even if we don't at this stage know exactly how much protection that is. And it will be safe. So when we get in touch with you, please go for the vaccine. It offers you a level of protection we don't have through any other means. If you're not in the first group called, please be patient. I know you will understand how important it is that we protect those who are most vulnerable to serious illness and death. A safe and effective vaccine does bring hope. It gives us all encouragement that where we are now will end. But right now, we have to all keep following the necessary restrictions, tough though I know they are, keep washing our hands, wearing face coverings, keeping those 2 metres distance. That's how we protect ourselves, our loved ones and our NHS, as science itself brings us hope.
The Cabinet Secretary will now take questions on the issues raised in her statement, and I will allow around 20 minutes for that. It would be helpful if members who wish to ask a question would press the request to speak buttons, and I call on Donald Cameron.
Thank you, Deputy Presiding Officer. Can I thank the Cabinet Secretary for advance sight of her statement. The recent news that various vaccines are proving effective during clinical trials is very welcome, as is news that the UK Government has now ordered some 355 million doses from 7 different developers, more per head than almost any other country. Given the various problems encountered with this year's flu vaccination, there is understandable concern about how the government will manage the rollout of a COVID-19 vaccination in order that the public has full confidence in this programme. With that in mind, the statement lacks many details on the practical aspects of delivering the vaccine, and further clarity would be welcomed upon the exact makeup of the dedicated workforce and how the government will address issues in delivering vaccines, for instance, to care homes in higher tier levels. But can I ask her this? Will she confirm today how COVID-19 vaccines will actually be delivered to the public, taking into account Scotland's unique geography of high-density urban areas and sparsely populated rural areas? And can she confirm how vaccines will safely be transported to delivery points once they are in the possession of health boards?
Jean Freeman.
I'm grateful to Mr Cameron for his question. And in listening to the statement, I'm sure he understands there are some parts of his question that I cannot confirm. So, for example, I cannot confirm the detail of transportation because we do not yet know on the first of the vaccines that has come through successfully stage 3 trials and is now being considered by the regulatory bodies, all of the vaccine components that will determine the nature of transportation and its stability through transportation. That's partly what I meant when I talked about the unknowns. And that information is coming through to us on a regular basis. My officials are involved at a UK level in all of those discussions, including with the Joint Committee on Vaccines and Immunisation. And later today, there will be another 4-nation health ministers call where all of us, because we're all grappling with those same unknowns, will work through how much more we do know at this point. And that's why I committed to updating the information today on a regular basis to members. And that applies, for example, to answering your question about exactly how will we deliver the vaccine in care homes. What we intend to do is to take the vaccine to care homes and deliver in each care home both the staff, vaccinate in each care home both the staff and the residents. There's necessary elements of this which are underway, which is about appropriate permissions from people that they agree to be vaccinated. However, we need to know the properties of the vaccine, the packages that it comes to us in, and whether or not we can then transport, for example, the Pfizer vaccine from that very high, very low temperature storage facility to individual care homes. And if we can, because the package sizes are right, do we need more than the 22 commercial freezer storage that we currently have? Do we need that in smaller sizes in more locations around the country? So there are elements of this that are the unknowns that we have options on in our outline plan, but we can't firm up on until we have the detail about exactly the properties of each of the vaccines that come through successfully. And the final point about detail about delivery. So our boards are looking at doing two things. One, using some of the existing flu infrastructure in those larger walk-through and drive-through flu vaccination centres, more appropriate for urban areas and more appropriate for certain cohorts of our population. We will also use mobile vaccination units. We will use more local high street vaccination centres. That's where our partnership with our local authorities come into their own. And we will make sure that we are as accessible in the vaccination programme to people the length and breadth of Scotland, taking account of that geography, but also accessibility in terms of circumstance where people do not have their own private transport or their age gives them issues around mobility that we can. And the final point I would want to make, depending on the vaccine's properties, we will look to be using the health service resource to vaccinate some people at home, because that is much easier for them to receive the vaccine in those circumstances.
Monica Lennon.
Thank you, Presiding Officer. It's clear from the Cabinet Secretary's statement that the workforce will be absolutely crucial to the success and speed of this vaccination programme. So with that, I have a few questions. You might have to follow up in writing with some of them for brevity. But when the first delivery of vaccines arrive in Scotland, how soon does the Cabinet Secretary expect the first vaccinations will be administered? Of the 2,000 vaccinators and support staff needed by the end of January, what proportion will be vaccinators? Will there be any additional recruitment? Will non-registered clinicians receive training to become vaccinators? And the Cabinet Secretary mentioned GPs and the role that they will play, and that's clearly welcome. But can I ask what additional support will be in place to ensure that the day job of GPs in terms of seeing patients on a timely basis will still be able to continue?
Jane Freeman.
So there are a lot of questions there, as Ms Lennon rightly says, and on some of those I will write to you, and that applies to others because there is a lot of detail. We are ready. We hope that we will receive the first of the 320 doses that we expect in December, in the first of those in the first week in December, and we will be ready to begin the vaccination programme in the first week in December. There is national training underway. We are already redeploying some of the cohort of our flu vaccinators over to this work because the flu programme is well underway, and so some will deploy over. The rest will deploy further once the flu programme is completed. And we are recruiting, but the clinical expertise we have extends beyond our medical and nursing profession, of course, and it extends, as I said, into dentistry, optometry, pharmacy, and we've already had very positive discussions with those professions about their members wanting to be part of this national exercise and looking to see the shifts that they can sign up for. Because we don't expect this to be a 9-to-5 operation or a Monday to Friday operation at all, so that they continue to deliver their core service and undertake this in addition. That's why we're in discussions around terms and conditions around that additional extra work. The logistical work, the armed forces will provide a great deal of that, but again, our partnership with the local authorities and through the local resilience partners will help us in identifying locations, certainly, ensuring they're COVID safe. And of course, our National Procurement Service on PPE will ensure that there is the right delivery of the right level of PPE to all of those locations and that mobile units carry that with them.
We'll move now to open questions. Can I say I did allow a bit of extra time for the opening questions because of the subject matter of what we've got. But if I could ask everyone else to try and be succinct in their questions and as far as possible with answers too. And first we have Bob Doris to be followed by Brian Whittle.
Thank you, Presiding Officer. Parts of Maryhill and Springburn constituency will have lower uptake levels of the flu vaccine historically, although I know it appears thankfully to be stronger this year. Will the Cabinet Secretary ensure that NHS Greater Glasgow and Clyde work to deliver an uptake for any new COVID-19 vaccine, which is high in all parts of Glasgow and, of course, as we want to see right across Scotland?
Jane Freeman.
Yes, I will, and I should just make one quick point, and that is those mobile units that we're talking about in those local high street centres is precisely so that we can reach people whom we perhaps in the past not been able to reach as well.
Brian Whittle, followed by Stuart McMillan.
Thank you, Deputy Presiding Officer. The Cabinet Secretary and I discussed the practicalities of delivering a population-wide vaccine in a call last week. I know that she recognises the need to ensure the public understand the realities of this vaccination process. So can I ask what consideration she and her team have given to the impact on restrictions during the programme for those who will be waiting for their turn while others are vaccinated?
Jane Freeman.
So I'm assuming Mr Whittle is talking about the strategic framework level of restrictions. And that is why, for example, for many of those certainly in the first wave in terms of the 80 and over who are not in residential care, ideally we want to be able to deliver that to those individuals in their own home. Partly to take account of their mobility issues they might have, but also to ensure that that is as safe as we possibly can make it. That depends on the properties of the vaccine and the degree to which it is stable if it moves at any distance at all. And we will know that very shortly. All of this work is happening at pace, not just here in the Scottish Government and with our partners, but in terms of JCVI, the regulators, and the organisation, companies like Pfizer and others, in producing the information as quickly as they can so that we know what the delivery schedule would be. Elsewhere, that is also why we are trying to ensure that we have what I'm terming high street locations, so that people do not have to travel far in order to reach the location. The location will be COVID safe in terms of how it is organised, how people go through that location, the timetabling of their appointments, and of course all the other measures including PPE and hand sanitisers, as we have seen our boards deliver in terms of the flu programme.
Stuart McMillan, followed by Neil Findlay.
Thank you very much, Presiding Officer. Cabinet Secretary, you touched upon there regarding the public locations, and certainly local authorities will also own and run many community centres and also sports centres, particularly in some communities, certainly in the Greenock and Inverclyde constituency. The utilisation of these would be extremely important and useful because of, particularly with the older community, who are very much spread out across the constituency, but at the same time, there are some pockets of very many of the older population.
Jane Freeman.
So yes, that's precisely the kind of discussions that we're having with local authorities to access those locations in partnership with them.
Neil Findlay, followed by Mark Ruskell.
Last night I was contacted by home care staff, a community nurse and 2 ward staff, all in contact with COVID patients, advising that 8 months down the line, none of these individuals have been tested, not once. Given that shameful situation, what confidence can they have in being near the front of the queue when the vaccine comes? And what is meant by frontline health and social care staff? Because these people do not appear to be regarded as frontline just now. And finally, can I ask if designated staff family members will be vaccinated to ensure sure they can visit care homes?
Jane Freeman.
So I've just set out that the frontline, and by frontline we mean patient saving, patient-facing NHS and social care staff. Social care staff includes not only those staff who work in care homes, but home care staff. They are in that very first wave, so over the month of December and January, they will be offered opportunities to be vaccinated. In terms of testing, the member knows that I will set that out, our rollout of routine asymptomatic testing here in this chamber next week. In terms of designated visitors, the JCVI information and advice is very clear that you work through age cohorts, and the only sectoral exemption to that is NHS and social care staff. We have extended that definition ourselves to take account of unpaid carers and personal assistants, but the JCVI is very clear that the clinical evidence is crystal clear for them that you work through the age cohorts because they are the most vulnerable to serious harm from the virus, including death. So that is the basis on which we will work through the delivery of the vaccine.
Mark Ruskell, followed by Alex Cole-Hamilton.
This is a very welcome statement. It shows that there's light at the end of the tunnel, but of course there's still a huge amount of work to actually get there. Can I ask about the extended flu vaccine programme? Because there were major logistical problems in some health board areas, including NHS Fife. So what has the government learned about that experience? And is there a case for a particular support for individual health boards that may struggle with capacity and other problems?
Jean Freeman.
So I think we've learned two things, and we're now, at least two things, and we're now implementing them. The first of those is the importance of a national plan that is then delivered locally, but that is very different from 14 territorial health plans. So the national plan is really clear, and it sets out the parameters within which a health board has to then organise its local delivery. And that is that it has the widest possible range of delivery locations, the kind of staff that they need to recruit, how they will support and train those staff using the national training programme. So the two main things I think we've learned is the real importance of a national plan coupled with local delivery, because local boards know the geography much better at their level than otherwise, and the real importance of maximising the number of locations where people can be vaccinated, including mobile locations. The large mass vaccination centres work really well, but they work really well for a particular cohort of the population. And the group of the population that we need to get to first, mass vaccination centres are not the right places. So we need to do it differently, which includes vaccinating people at home, provided the vaccine's properties allows us to transport it in those small doses.
Alex Cole-Hamilton, followed by Annabel Ewing.
Thank you, Deputy Presiding Officer. This is a very welcome statement offering much needed hope. The Cabinet Secretary statement was 1,700 words long, but only 4 of those words covered the national booking service that will administer delivery to everyone from phase 2. That will be utterly crucial in the delivery of this vaccine. So I'd like to ask the Cabinet Secretary for some additional detail on the national booking service. Firstly, will it be automated or will it be staffed? And secondly, is it ready to go or is it still to be designed?
Jean Freeman.
Mr Cole-Hamilton should never judge the amount of work we're doing on the basis of the number of words I use. But the National Booking Service, as I said, it will be ready from phase 2. So phase 2 kicks in at the end of February and takes us through another couple of months thereafter. The National Booking Service is designed, but the detail of it is clearly not finalised because it's for phase 2. So what I will undertake is to ensure that every member knows the detail of what that National Booking Service is, whether it is automated, how people can get advice, what to do if you get an appointment time that you can't make, and so on and so forth, and how that connects up with the local delivery areas. And I will do that as soon as all of those details are finalised.
Annabel Ewing, to be followed by Jamie Halcrow-Johnson.
Thank you, Presiding Officer. I too very much welcome the news about the vaccine, as will all my constituents in Cowdenbeath. Can the Cabinet Secretary advise what the current thinking is in terms of what we know at this point about how the information will be disseminated in Fife so that people know what is to happen and when? And can the Cabinet Secretary also just confirm that for those in Cowdenbeath constituency or elsewhere in Fife who may struggle to get to a central location from their village or town, that they indeed will be able to get the vaccine where they live without having to get into a big argument and harangue about it? That will just be an automatic entitlement. Thank you.
Jean Freeman.
So in terms of information, as I said in the statement, we will write to those who are in that first cohort over the coming weeks to make sure that they know what the arrangements will be for them. That's particularly either directly to those individuals or through their employer in the case of health and social care staff. And thereafter, we currently have in train the planning and the content for a national door drop, which will provide every household in Scotland with detailed information on the vaccines, the safety of the vaccines, how we're going to deliver it, what to expect and so on. And in addition, I will write to every member of this Parliament with the level of detail that I gave in terms of the flu vaccine programme, so you know both the national and the local arrangements, and you have a named contact locally to go to direct as the MSP, where you have individual constituent inquiries. You can always, of course, come to me with those as well. In terms of local access, what I can say to the member is we are putting in place every possible step we can to try and minimise any travel that anyone has to undertake in order to be vaccinated. Now, in some instances, that may not be possible in a particular village, for example. I think of my own constituency, where that is really difficult then for people to travel to perhaps the village next door or the nearest town. Then that's why we're deploying that huge clinical workforce, if you like, so that we can, in some cases, deliver the vaccine directly to someone in their own home, but as I've said many times, dependent on the properties of the vaccine and how stable it is, the more you transport it.
Just to let members know, I'm going to let this run on a little while, so we'll have Jamie Halcrow-Johnson to be followed by Alistair Allen.
The Cabinet Secretary will be aware of particular issues facing remote and rural areas of the Highlands and Islands and the additional challenges many already face in delivering the winter flu programme. So can she comment on what planning is already underway to support the rollout of a COVID vaccine in our rural and island communities? Because this will be vital in ensuring that as many as possible have access to vaccination and that no one is left out.
Jean Freeman.
Mr Halcrow-Johnson is very right, and in fact my own constituency is largely rural, and for many, particularly in the most southern and eastern part of that constituency, local towns are not as accessible as people might think they are. So with individual boards, so each individual board, the discussions are underway about what makes most sense in their area. So how many mobile vaccination units do they need? Where are we using local authority property and facilities, large or small? How are we working with the third sector, who may also have, and indeed our faith groups, who may also have locations that we can rent from them and turn into a COVID-safe vaccination centre for small numbers? All of that is underway. For some parts of our country, mobile units will be more effective than that. That may be the case in some of our island communities. For others, it will be using those very local community centres or church halls or other properties, including sport and leisure, that local authorities have that we can access and make use to. We shouldn't forget not so much our GP surgeries, because we want, as Ms Lennon asked, to make sure that they can continue to deliver health care, but there are possibilities of clustering some of that. So every individual health board is in discussions with the national team to look at individually what they are doing and what makes sense. And I can assure the member that I then look across all of those 14 local plans to make sure that they are as comprehensive and assured as I need them to be.
Alistair Allen, followed by Rhoda Grant.
the very welcome rollout of any COVID vaccine is, as the Cabinet Secretary has recognised, going to present logistical challenges, especially given that one of the more likely vaccines needs to be stored at -70 degrees Celsius. Can the Cabinet Secretary confirm that some thought will be given to the needs of island communities in case storage requirements of that kind turn out to apply, and also how patient transport to centres will be organised in very scattered areas of population?
Jean Freeman.
So we are giving that a lot of consideration. It's particularly relevant, of course, to island communities, but also relevant to other communities in and around Scotland. In fact, if you go north or south of the Central Belt, many of those considerations are comparable. The Pfizer vaccine does need to be stored at that temperature, as Mr Allen says. There is also, as yet, an unconfirmed number of what they call transportation steps before it absolutely has to be used. You can't move it around any more than that. So that has an implication about where you get it to be distributed to in the first instance, if you follow me. And again, that's why, whilst we have 22 commercially sized fridges or freezers that will be deposited around the country, we're currently considering whether we need more of those or more of those, that standard of commercial freezer, but of a smaller size, that we may need to put in additional parts of Scotland in order to ensure that we can distribute the vaccine as widely as possible before we get to a point where we actually have to use it. That's about reducing wastage and making sure that we're not wasting vaccines, but are actually able to maximise the amount that we can then use to vaccinate individuals. Where members have particular areas of knowledge about their own constituency area, it would be very helpful, and I would very much welcome hearing that from them, that we need to pay particular attention. Mr Allen has done this with me before very helpfully, pointing out the nature of the Western Isles community, that, you know, as someone who doesn't live there, I would not necessarily immediately understand. So I'd very much welcome from any member any particular constituency aspects that they want us to make sure we pay attention to.
Rhoda Grant and then Shona Robson will be the final questioner.
Thank you, Presiding Officer. The Cabinet Secretary will be aware that many of my constituents can't access COVID-19 testing simply because of where they live. Can she give them the reassurance that they will receive the vaccine regardless of where they live? And taking into account that she is not looking to use GPs, and some of those people will need home testings, home vaccine, they really need a reassurance that they're not going to be left behind.
Jean Freeman.
My apologies to Ms Grant if she picked me up wrongly, but I am using GPs, although of course it is entirely for GPs to volunteer to do this, as it will be for pharmacists and dentists and others. So the GP and the GP practice nurse and other clinical teams that they may have in their practice are very welcome to be involved in this programme. And as I said, we've reached an agreement with the BMA on financial reimbursement for them to do that. So in your particular area, then the GPs may well be involved, as may others, the district nurses, family nurse practitioners, local pharmacy and so on. So the assurance I give is that we will do everything we possibly can to ensure that every citizen in Scotland who is eligible for this vaccine, so that's all adults over 18, is able to access the vaccine and be vaccinated, whether that means we take it to their own home or, as I've set out already this afternoon, the very many local locations that with our partners in local authorities and others, we're actively looking to ensure we set up, as well as mobile units, which I would think are particularly relevant in the Highland community. And one last thing, Ms Grant, I'm sure, knows that there are a number of additional local testing centres about to be set up in the Highlands, which I hope will assist with access to testing for her constituents.
And the last question is from Shona Robson.
Thank you very much. Can I ask the Cabinet Secretary if she can provide an update on the Phase 3 COVID-19 clinical trial currently underway across Nhs Tayside and how this can better inform the national rollout of a vaccine when it's available, and whether the national door drop information campaign will also be available and easily accessible information for those who have additional support needs. Thank you.
Jean Freeman.
My apologies to Ms Robeson. I don't have the detail with me of the Tayside trial that she references. I'm very happy to send that to her later on. In terms of the national door drop, yes, of course, it will be available in a number of languages, as we normally do, and we will also pay very close attention to other forms of communication to ensure that all of our citizens are able to have and understand and make use of the information that we provide, whether through the national door drop or in the many other channels that we will use.
That concludes questions on the statement on COVID vaccine, and we'll move on to the next item of business. Meanwhile, can I remind members about the social distancing measures as they enter and leave the chamber?